Well, according to Health Canada, obesity in children has nearly tripled in this country over the last 30 years. Now there are new guidelines to help treat those children. We welcome Dr. Tasneem Sajwani with Obesity Canada for more on this. So this new report comes out with these new guidelines. Can you tell us about some of the biggest changes we've made?
Well, the biggest changes would be that we now have more tools in our toolbox to potentially offer our patients with obesity, not only adults, but children specifically and their families who struggle with obesity. So in the past, we've relied mostly on the old adage of exercise and dieting is what's going to help these children move forward, whereas now we have a few more tools in our toolbox. That is a really great conversation that we can have with our families and our children, where we can give them more options in moving forward and actually helping them with improving their quality of life and to reduce their disease burden.
Okay, so beyond diet and exercise, what are some of those new tools in the toolkit?
So fortunately, we do have some effective pharmacotherapy and we have some surgical options just like we would for adults. However, again, these are tools that we can have conversations around, but not the be-all, end-all. This always goes with the psychological and the behavioral interventions, nutrition, physical activity, discussion, and options.
Now, we talked at the beginning about the numbers growing in Canada, people with disability and specifically children. What are the risks associated with obesity?
So children that have obesity tend to move on to have obesity in adulthood. In fact, 80% of children that are in the age of 12 to 17 that have obesity move on to having obesity as adults. So the diseases that are associated with obesity, almost 200, but more commonly hypertension, diabetes, different cancers, actually become more risk for them as they move forward into their lives.
So for parents and guardians who are watching right now, what would your advice be as when to seek potentially help with obesity?
I think being in really great communication with your healthcare providers in general, just to discuss general health. This is where we can potentially diagnose those issues early. And if there is a diagnosis of obesity, because obesity is not just a BMI, obesity is not just a social construct of what people think is obesity, but if truly there is adiposity that affects health, that harms children, then there is that conversation to be had. And I think the only way we can do that is to have those clear communications, frequent visits with their healthcare providers.
Now, this report also says obesity is a chronic disease. What does that mean for people?
It means that this is a chronic, relapsing, remitting disease that is usually genetically conferred. It is not something that we can treat and disappears. This is something that we do need to manage for the rest of our lives.
Okay. Now, what else would you like for people to take out of this? Because this has been a long time coming, these new guidelines, this change of approach. What would you like people to know? Because as you make the medical changes, it may take a while for society to make those changes. What would you like people to know today?
That weight and obesity is not a behavior. This is truly a chronic medical disease. Again, I'm talking about adiposity that causes harm, not the social construct around what obesity looks like. And if we don't tackle this early on, and if we don't tackle this when it is occurring, then we are going to move into areas of more severe disease. And we want to prevent that. We want to start treating it early so that these children don't have to deal with complications of obesity and diseases associated with obesity.
Well, it's an important conversation, long time coming. Thanks so much for joining us this morning.
Thank you for having me.
Now, you can find the guidelines and more information when to seek treatment by going to obesitycanada.ca.